today we're going to go over the IV skill video, and so I'm going to insert an IV onto this mannequin arm. First thing that I'm going to do, I'm going to walk into my room, introduce myself to my patient. So my name is Valerie and I'm going to be your nurse today. I'm going to wash my hands before I touch the patient, provide for privacy, and explain to the patient that we need to get an IV started on them today. If they're okay with that, I'm going to ask my patient their name and date of birth, make sure that I've identified them correctly and they are the patient that I need to put the IV in on. And I need to arrange supplies. So I need alcohol hand sanitizer, clean gloves, an IV start kit, extension tubing, saline flush, an appropriate sized IV, and then extra alcohol preps if I need them. So before I actually go to put a tourniquet around my patient's arm, I need to make sure that there's no reason that we shouldn't be using one arm or the other. In general, we try to stay away from the dominant arm because that's the arm that we eat with, pick objects up with, we just use it more. So I'm gonna ask my patient, are they right or left-handed? Other things that I need to take into consideration, so if they've had a stroke, if they have any other IVs or especially central lines on that side, if they've ever had trauma, extensive scarring, any wounds at this time, I need to stay away from those, any bruising, and then especially dialysis fistulas, and if they've had breast or lymph node surgery on that side, we need to avoid that side as well. So if my patient denies all of that, again, I'm usually gonna go with the non-dominant arm. I also wanna try to stay away from the bend in the elbow and the bend in the wrist because it's uncomfortable. Usually those IVs end up kinking off and it causes issues with obstructed flow. So I've selected my arm and I'm just gonna inspect the arm again. So I'm looking for any bruising, trauma, which I don't see. And I'm gonna go ahead and prep my supplies before I put the tourniquet around my patient. I'm gonna put my gloves on first. So wash my hands and just clean gloves. So I'm going to open my IV start kit. I've got my chlorhexidine prep, extra gauze, a Tegaderm tape, and a tourniquet. I'm gonna go ahead and tear my tape. So I want one piece to secure the actual IV at the insertion site, and then I want one to secure the tail of my extension tubing. For my extension tubing, I'm gonna go ahead and prime it with my flush. So as soon as I get blood return, I can attach my extension tubing. Clear the air. I'm gonna attach to my extension tubing, and I'm gonna remove the cover that I'm actually going to attach to the catheter once it gets inserted. So I'm flushing a little bit of saline through, and I'm just gonna leave that in the package until I'm ready. So I'm gonna tie the tourniquet around my patient's arm. Ideally, I wanna be about 4 to 6 inches above where I'm gonna insert. Usually right above the AC is a fairly simple spot. Whenever I tie this, I'm gonna do a slip knot. So I have 2 tails. Once I'm done, I'm gonna just pull that tail right there and release the tourniquet. So I'm going to assess. I'm looking for any veins that pop up, and I wanna make sure that I can also palpate that vein, making sure that I don't feel any valves. So I think I'm gonna insert right about there. I'm going to release my tourniquet while I prep the arm because I do need to use the chlorhexidine, and then I need to make sure that it is completely dry without fanning it or blowing on it. So with chlorhexidine, we're gonna do 30 seconds up and down. Okay, and 30 seconds side to side. Usually I wanna be at least 2 inches away from where my insertion site is gonna be. Okay, and then I'm gonna let that dry. Okay, so now that my site is dry, I'm gonna reapply my tourniquet. Again, I'm using the slip knot. Make sure that I have the tail. Wait for that vein to pop back up. I'm not going to palpate that vein again because I don't want to touch my clean glove to what I just cleaned with the chlorhexidine. I'm going to take my needle out. And when I go to insert, I want to make sure that the bevel of my needle is up. It is a little hard to see here. Usually most of these have a finger position that tells you which way is up. So the sharp part of the needle needs to go down. Whatever vein I chose, I'm going to anchor with the thumb of my non-dominant hand below where I'm going to insert. I'm going to insert my needle at a 10 to 30 degree angle. Okay. All right, I'm in the vein, and once I'm in the vein and I get blood flashback, what I'm gonna do, take my index finger and slide forward and take my thumb and my middle finger and pull back. So I'm pushing that catheter all the way into the vein while I'm pulling the needle out. Once I'm in, I'm gonna release my tourniquet, and then I'm gonna apply my extension tubing. So I'm anchoring my needle, and then I'm going to attach that. I'm gonna pull back slightly to check for blood return, which I have, and then lightly flush just to make sure I'm monitoring for any blebs of fluid or edema or pain. Once I've got my needle inserted, I've checked for blood flashback, and I have flushed my syringe. I'm gonna cover my IV site with the Tegaderm. I don't want anything else underneath this Tegaderm, no cloth, no cotton balls, no tape. Remove that dressing. So my tape that I tore earlier, I'm going to secure right there at the insertion site. Can disconnect my flush. And then I'm gonna tape the tail so it doesn't get caught on anything. Okay, and I'm gonna make sure one last time that my patient's comfortable, they're not having any pain. If they say no, then I'm going to take part of my Tegaderm here, take my pen, put the date, the size of that IV, and my initials, and attach that to the dressing. Okay. So once I'm done with that, I'm going to put my sharps in the sharps container and the rest in the trash. And then I'm going to exit my room, make sure the bed is in the lowest lock position, alarm is on, rails are up, no more than 3. Any other needs are met, and that my area is clean and tidy. I'm gonna give my patient the call light if they need me, leave the door open on my way out, and wash my hands before I leave.